Hi, my name is Kendra Rekevics, and I'm going to be talking to you about ACL repair, also known as anterior cruciate ligament repair. So today you're going to learn about the different ways to repair an injured ACL with a focus on the surgery aspect and the 3 different grafts used in reconstructive surgery. By the end of this lesson, each one of you will be able to make a decision on the best way to repair an ACL given a specific situation. You've all received a handout when you came into the beginning of class, so throughout the lesson, refer back to it and fill in the blanks so you have information for later on to look back on. You've also received a scenario, and at the end of class, we're going to go through it and decide, based on the scenario, which type of ACL repair would be best, and we'll discuss it as a class. So make sure to pay special attention to the lesson in specific to that scenario. So first we're going to go over some vocab, and ACL stands for Anterior Cruciate Ligament. Ligament is a band of tissue serving to connect bones or organs in place. A tendon is a cord or band of dense, tough, fibrous tissue serving to connect a muscle to with a bone of a part. Cartilage is a firm, elastic type of connective tissue. And muscle is an organ composed of muscle tissue that contracts to perform a particular movement. So let's look at the anatomy of a knee. The ACL is one of 4 main ligaments within the knee. There's the ACL, which runs diagonally throughout the knee, the lateral collateral ligament, which runs along the side, the posterior cruciate ligament, which runs behind the ACL, and the medial collateral ligament, which runs along the side. Some other points to look at that are important in the anatomy of the knee are the lateral meniscus, which runs along the side, and the medial meniscus, which runs down here as well. The ACL runs diagonally in the middle of the knee, which prevents the tibia or the shin bone from sliding out in front of the femur or the thigh bone. It also provides rotational stability to the knee. It's the most important structure in the knee for providing stability during sports, physical activity, and any movement that requires change of direction with speed involved. If the knee is unstable, cartilage wear and tear can happen over the years, which eventually leads to arthritis. Now we're going to talk about some statistics on causes of ACL injuries. So ACL injuries estimate about 200,000 annually, and of those, 100,000 reconstructions are performed per year. Approximately 50% occur in combination with damage to the meniscus, articular cartilage, or other ligaments. And incidents of ACL injuries are higher in high-risk sports, and of these, there are 4. They are basketball, football, skiing, and soccer. Some of the causes of injuring your ACL are changing direction rapidly, stopping suddenly, slowing down while running, landing from a jump incorrectly, or direct contact or collision, such as in football. In this picture, you can see what a normal ACL looks like, and this is what it would look like if it was torn. Here's an image from inside somebody's knee of a normal ACL and a torn ACL, and you can see the difference between the two. Studies show that female athletes have a higher chance of ACL injuries than males do, and estimated 70% of injuries occur through a non-contact mechanism, where 30% result from direct contact with another player or object. Does anybody have any questions about what we've just discussed? Now we're going to talk about surgical repair and the grafts used. So there are 2 categories of grafts used, autografts and allografts. Autografts are medical grafting of a bone or tissue from the patient's body, and an allograft is the use of bone or tissue from a donor's body, which is most commonly a cadaver body. So of the autografts, there are 2 options, the patellar tendon and the hamstring. The patellar tendon is the structure in the front of your knee that connects the kneecap or the patella to the tibia. And your hamstrings are the group of muscles on the back of your thigh. So those are 2 options, and the third is an allograft. Now let's go into detail of the 3 different graft choices. Please look at the scenarios you received at the beginning of the class, read yours quietly, and figure out which type of repair you would use if you were in that situation. After this, we're going to talk about it as a class and discuss which choice you used and why. You're now going to watch a video from the surgery I had so you have an idea of what the inside of a knee actually looks like, as well as some of the procedures the surgeon uses. Alright, thank you everybody so much for coming to this class. I hope you gained a better understanding of the different ways to repair an ACL. And remember to talk to your doctor about this decision, as they'll have more information and a better understanding of the best way for you to have the best possible recovery. Thank you so much, and if you have any questions, feel free to talk to me after class or take my business card and contact me at a later time. Thank you.